We're talking with Cody Johnson of the DeKalb County EMS, the ambulance service. Cody, tell us your title again.
I'm a critical care paramedic.
Okay, and tell us what we have here today.
We have ventilators and we have a video laryngoscope. I'll go over the ventilator first. Ventilator allows paramedics to ventilate the patient with a more custom approach. 3-year-old pediatric is going to have a different breathing needs than a full-grown adult, and with that, each patient's able to get a more custom ventilatory rate and oxygen delivery. So when we're at a hospital, once we get a patient stabilized and take them to the nearest hospital, if their breathing ability is compromised and we have to breathe for the patients, we're able to place them on a ventilator, and after they're stabilized at the local hospital, we're able to transfer them to a higher level of care. And with the ventilator, it allows paramedics more time to better calculate medicines and to reassess the patients, all without having to worry so much about making sure the patient's getting the proper amount of oxygen and proper ventilation rate. So over here, we have a video laryngoscope, a classic laryngoscope. A paramedic is able to place this part into the patient's mouth and lift up their tongue and lift up their epiglottis, so as when he sticks in an intubation tube to get perfect access to the patient's lungs, he has to have direct visual on the vocal cords. With a video laryngoscope, however, it's able to see around the tongue a lot easier and a lot better for patients that may have a bigger tongue or is really hard to intubate for any number of reasons. So with this, we're able to see around the tongue and able to intubate a lot easier, better confirming that we have a good airway when transporting the patient.